when I first came into holistic medicine, my thought was to actually work with those who had chronic pain and fibromyalgia. And my first client was a cancer patient.
Must have meant to be.
Well, yeah, and I truly believe that. I do. I absolutely believe that you know, you are put on a path that you're meant to be
That's
on.
right.
And I would say that out of the practice, and I've dealt with geriatric and palliative care, I've dealt with chronic pain issues, certainly a lot of cancer patients over the years. I would say probably the greater majority, 75% of my practice is cancer clients of all types of cancer, but breast certainly seems to be predominant within it. So it's one of the reasons why I took additional training through a naturopathic physician to be a healthy breast teacher, so that I could help to educate women that, you know what, you can live a better life, you can live a more healthy life, you can find joy and purpose in your life, and you can make the kind of journey
That's
that
right.
that you
Education
have
and
to have.
awareness is so key. I mean, there's a lot. I know when I was first diagnosed, there was no indication that there was anything wrong, and the doctors kept saying, you know, don't worry about the biopsy, don't worry, it's nothing, and I truly didn't, because there was not a history of cancer in. And that's one of the common fallacies of today, that people think cancer is genetic, but it's kind of on the low end of the scale, that it's not genetic, that most of the cancers are non-relevant to genetic. They're not really sure total pure causes of it, but
I think they're coming more to environmental.
they're leaning towards environmental, but that in itself is the whole of the what we eat, what we drink, what we breathe, which we don't have any control over. Our stress factors, the technology, like everything, the whole environmental issue. But it's certainly, I didn't know anything about it, but the one thing about if you are diagnosed or you come across a serious illness, is to educate yourself, make yourself more aware, and make others more aware of, breast self-care, do your self-breast examinations.
Absolutely.
I can't talk enough about massaging the girls. I mean, checking the girls out.
Yes,
and
get up close
days
and
gone
familiar
by,
with
we
them.
wouldn't dare talk about that. Our grandmas, our moms.
Touch your breasts,
and,
oh my gosh.
oh my goodness, don't do that. But it is, you need to know your body and what it feels like. And there's ups and downs, and you go through, if you have your cycles, your hormones, it changes. But those changes are just normal. Not all of them mean bad things, but it comes down to educating yourself and making yourself aware.
Doing a breast mapping on a monthly basis is a great idea, don't you think?
Yes.
Taking a look at, and to do that is actually relatively simple, as you draw a picture of your breasts, both of them, whether one is reconstructed or not, they are still your breasts, quadrant it off, and on that map each month, make photocopies of it so that you can see, you know, where your breasts are. You need to do at least a monthly self-exam. If you have been a breast cancer patient, I want you to examine yourself weekly. I want you to be mindful of where changes happen in your breast. Does this feel pea-like? Does this feel hard? Does it hurt? Does it not hurt? What size is it now? If you are still menstruating and you are experiencing your cycle, does this come cyclically? You know, is it only around your cycle? Is it something? And be mindful of that, and then take that to your doctor if you have a concern and say, you know what, I have been mapping my breasts every month or every week or whatever, and this is what I'm seeing, and you know, it can tell you sometimes, well, you know, maybe you've got a blocked milk duct, maybe you have fibrocystic breasts, in which case you have to be much more mindful. If you're older, you could have calcified deposits in your breasts, and if you have them bilaterally, that's not really uncommon, but it doesn't mean you're out of the safety zone either. If it's only on one side, you might have a greater concern. So, you know, it's really important to be very familiar with your body, and also familiar with, you know, patterns of your menses, and, you know, palpitating your abdomen, and do you feel anything? Because ovarian cancer is one of the greatest silent killers. And as a breast cancer patient, you know, you have more of a predisposition to things like ovarian cancer and bowel cancer, you know, if I'm not mistaken, and things of that nature. So it's really important to be aware. Now, a lot of times we live in our body but we're not in touch with our body, so we don't pay attention to the things in our body that we really need to.
You don't
so.
stop and smell the roses, which
No.
means listen to your body.
Yes, you have to listen to that inner voice, and you know, truly, if you have a feeling that something is wrong, it usually is.
Mhm.
So you need to be very mindful of that. And you know, we have a great physician here in town, Dr. Annette Richards, and she has the Face It program. And one of the things that she does say is, you know, one of the fallacies that people think of is, you know, well, if it hurts, it's not cancer. Well, that's wrong.
That's wrong.
Because, you know, it can hurt and be cancer. So you need to be very mindful. Any discharge, any changes in look. You know, look at your girls every month. You know, do you see any visible changes? Are there any inversions? Are there any dimples in the breast? Are there any changes in color? You know, there's also inflammatory breast cancer, which is like a sheet of cancer in the breast. It's not a single palpable tumor. So I mean, there are lots of things, and we need to teach our daughters. And we need to teach them from a young age. And one of the things that we need to do is to help them delay their puberty somewhat. So we need to be very mindful of the types of things that they eat, and in particular, because our beef products in particular are oftentimes hormone fed, you have to be really careful what they're putting in their bodies.
That's right. That's right.
So that they don't develop their breasts very early, so they don't have an early onset of menses at like age 8 or something completely absurd like that. The longer they can wait before the onset of their menses, the better it is for them. You know, and we want to prepare our bodies too. If you want to be a mom, you know, it's really important to detoxify your body, because we accumulate PCBs and all kinds of things in our bodies, and that comes out in our breast milk. We do not want to pass that on to our babies.
Pass that on.
You know, your first baby can pass on half your lifetime load to. So, you know, you want to be mindful of preparing for things like that too. So it's not just about breast cancer, it's about total body feminine health.
That's right.
When you look at it. So I'd like to thank Tammy for being with me today. I'm really delighted to sit here and chat with you, Tammy, about your journey and how maybe that will help others to say, you know, I went through that too, and I'm really glad to hear somebody else has done it and come out the other side and seen the sunshine, and you know, things are going to be
And the sun
positive.
does shine, that's right.
Yeah, it's actually shining today. So it's been a great time. So if you want to contact me, you have my website, www.essentialtherapies.ca, and you can contact me through the website, or you can contact me through essentialtherapies@rogers.com. That is my email address, and I'd be happy to answer your questions. If you wish to order the pre-radiation or radiation creams, the Healthy Breast Oil or essential oils, that's also available on the products page of the website. And again, I'm at your service. So if you have questions, please feel free to call or email. Okay, thank you.
Thank you, Gail.
Thank you.